I hope everybody is having a fantastic start to their October, best month of every year because it kicks off our AEP. Many of you I met when I was at United, when I ran the institutional equivalent plan that we brought forward to Pinnacle. I have left the Optum UHG organization this past May and joined an organization called Signify Health. Signify Health is an organization that works with not just one payer. We actually work with over 100 different carriers. So that's why, being able to come back to you as our friends and partners at Pinnacle is so, it's like coming home again. So I so appreciate Serena allowing me to come into your life again and share with you something that we've designed specifically for brokers in mind. Let me tell you a little bit about who Signify Health is. Signify Health is an organization that has worked with payers for a number of years. We go out and we are asked from the carriers to go and to see members in their home. And these are the people that go into our members' homes are nurse practitioners, they are physician assistants, they're DOs and MDs. And these clinicians go into the home and they're asking a lot of questions. How is their health plan? Can they access their benefits? They talk about their chronic conditions if they have one. They want to make sure that they're able to fully utilize their health plan. The clinician also partners with the primary care physician. They do not take the place of a primary care physician. What they do is, once again, they're going in that home, they're seeing that member, they're having a conversation with that member. They're also examining kind of from the top of the head to the bottom of the feet of that member. And then they're sending that information to their primary care physician. Some really great success stories have come out from our interactions with members. In the last few months, we had a member who had an interaction with a member. A clinician was putting on that blood pressure cuff, felt a rough spot on someone's arm, and said, "Have you had that looked at?" The member said, "No, I had not." The member was like, I keep putting lotion on it. Clinician said, "I really want you to get that checked. Make sure and see your primary care physician in the next week or so and have that looked at." The following week, that clinician reached out to that primary care member, found out that that member had not called them to make that appointment. Clinician called that member again and said, "Hey, want to make sure that you get that primary care appointment. I know you haven't seen your doctor yet. Can you make that appointment?" They had that appointment. It was the beginning stages of skin cancer. Because that clinician felt on their arm that rough spot while they were going to take their blood pressure, that small spot, which they were easily able to go ahead and just do a Mohs procedure on, they actually caught it really early stages. Could have been much more disastrous. We have had hundreds of thousands of success stories. I actually have on this presentation, and you'll get today, some success stories that you can see, and it's from the members themselves. So once again, Signify Health, we go into that home. We are gathering that information. We are sharing that information with the member themselves. If they have a family member there, we are, if they have the daughter or son and they want to be there, absolutely. We listen. We go through all of their medications, making sure they're taking them correctly. We close those care gaps. We communicate back with that primary care physician. So we work with our members to ensure that we're able to improve that care coordination and be able to, once again, have those questions answered. Typically, these visits can take anywhere from 45 minutes So sometimes we've seen people go to up to 90 minutes. The reason being is members have lots of questions, and this clinical team member is there to answer them. So why does this matter to you as a broker? When we go into these in-home evaluations, we have an opportunity to help those members connect deeply with their health plans. 72% of all members who have had an in-home evaluation will go forward and have another one. We go in and we capture around 300 data points. We're looking at, can they walk up and down those steps? Is there any fall risk? We're closing those care gaps. We're asking them if they've been depressed. We're listening. We're learning from our members. And then also, so many of our members, they then go on to accept additional diagnostic testing, typically from their primary care physician, because we sit there and we walk them through why it's important. Those clinicians are there to help educate. So if somebody has a chronic disease and they've had some exacerbations, we can sit there and we can talk with them about the why and the how and what that means to them. So super important for us to once again connect those dots. So when you think about why it's important for the member, it's important for the member because that they have that highly skilled clinician right there, willing and able to help them. The average time that somebody spends with their primary care physician is between 7 and 10 minutes. That's it. These clinical team members are there for a minimum of typically 45 minutes. We help bridge that information gap and help people understand how they can become advocates in their own care. So let's talk about how Signify works. So here is just a really quick kind of visual. As you all know, I love visual things. It helps connect me with things. And some of the things that I want to share with you is that not every single member has the opportunity to have an in-home evaluation. Health plans select members to get an in-home evaluation. So let's say that, we are working, and we do, let's say with Humana or Aetna or United or Cigna or WellCare and Centene or Health First, you name them, we're probably working with them. And what they do is they send us that list of members. Today, what happens is we at Signify, we call, we send a letter, we may send an email, we may send a text message. But today, with you, we want to change that. For those members that we have that's available and eligible visits, instead of that, why wouldn't we ask you, the broker, to go ahead and schedule those visits? Today, once again, we call these members. We may call them in a 1-year time period 30 times. And do you know how frequently they answer the phone? Not very. But when you engage with your clients, they answer the phone. They engage with you on text messages. And instead of us calling them or texting them or sending them a snail mail, we're saying, let's stop that. And let's go ahead and ask brokers to initiate that opportunity. So today we're really kicking that off. What we want to do is have you, during this very important annual enrollment time period, include Signify as part of your workflow. It literally takes less than 45 seconds to see if somebody is eligible for an in-home evaluation. And I'm actually going to show you how in just a minute. But you can go online, right on your cell phone, on your iPad, on your computer, and you can literally check to see if somebody is eligible for an in-home evaluation. And so many people will ask me, well, what if I'm about to change them on their current health plan? We know that there's a lot of changes going to happen this year. That doesn't matter. This is about the member. So that information that that clinician collects and then sends to that primary care physician, actually, that's the member's information. So if today they are with a WellCare plan and you look to move them to a different plan and they have an available they are eligible for that in-home evaluation, you go ahead and book it in 2024. They may change, and you are changing them, let's say, to a different plan. That's okay, because that information stays with the member. Would they have another eligible in-home evaluation next year? There's a good chance. And guess what? You would then capture the $50 reimbursement for 2024, and then if they're available for next year, you could capture it again. So today, Signify calls. And what we want to do is flip that script and have you, the owner of that relationship with your clients, we want you to be able to schedule that visit. And I'm actually going to show you how to do that. And then once again, we send out those pre-visits. You all will not have to do that. We're only asking that you would schedule that. And then we, as Signify, come into that home. We go through their medical history, talk about their chronic conditions. We go through all of their medications. We want to make sure that can they walk down the steps to get their mail? And then what we also do is make sure that any of those additional services that that member has said they need help with, we connect those dots for them. And then we send that summary of that in-home evaluation. We send it to the member, and then we also send it to the primary care physician. So super important that we work with all of those folks. I talked about here how members feel about Signify. As you can see on the top right, there's a link, and we'll send out this deck for you so that you can hear from members what that experience was like. We want you to not just take it from me, but also listen to those members and see how they felt about that engagement. So today, once again, what we're asking for is that you, while you're working with your members during this AEP, that you would schedule that in-home evaluation. And you would be able to do that on the, as you can see right here, schedule.signifyhealth.com. For every single person that has an eligible in-home evaluation, every person that you schedule, we will pay you $50. And that will be paid every month to Pinnacle, and they'll distribute that money. Scheduling literally takes just less than a minute, and that's if you're hunting and pecking on the keyboard. It's super easy, and I'm going to actually show you how. But the one piece that I did want to mention that I think is so important for all of us when we're in AEP is we know how difficult it is because there are so many people contacting your member. So when you think about you scheduling a clinical appointment, that really helps to tether that member to you, the agent, because they will typically write it down that they are going to have a nurse practitioner or a DO or a physician's assistant or an MD come to their home. You've scheduled that appointment. So when one of those telephonic messages come on and they pick up that phone and somebody is saying, hey, let's change your Medicare Advantage plan, they can say, no, thank you, and I have a clinical visit coming. Because we know when somebody has a clinical visit, it helps tether them to you as the agent. And that, to me, is so very important in this really chaotic time during AEP. So I'm going to actually X out of the presentation, And I'm actually going to show you how this works because I like to see how things work. I think that's super important for all of us so that you can see how truly easy it is to schedule a visit. Here we go. And I'm going to schedule, if I could spell here, schedule.signifyhealth.com. And you can see I'm going to come down here, and this was made just for you all so that we can, once again, collect this information on you as the broker being able to schedule that visit. So today, people will come to this website. It's a public website. And people go ahead, and I told you that we call them, we send them text messages, and people come on here and they do book their own appointments. But mostly, about 85% of all schedules are scheduled because we call them. So this is once again our portal that you as the agent will go on. So you'll click this and it says schedule an in-home health visit. When you first type in your information, and you can see my information right here, it captures it. So whatever you are on, you can actually it'll capture it and you won't have to do it again. Now, if you switch devices and say you do it one day on your cell phone and then the next day you do it on an iPad, you would have to put it into the iPad. But I have put my information here, and you see I put my Jill training. I'm with Pinnacle, and I went ahead and agent ID, we like to have that NPN number in there. So I'm going to go ahead and I'm going to fill out this. So I am putting in here my my name of my member that I am taking care of. And I type in first name, last name, the date of birth. And then also I can ask them either for their Medicare beneficiary ID or their health plan subscriber ID. And why this is really great during, once again, your workflow during AEP is you can have them pull out that information, or you may have that information already handy yourself, and you'll be able to simply check to see if they are eligible. Because once again, not every single person is eligible, but out of a universe of, we have 10 million members this year that we are trying to schedule by the end of 24. It's a pretty big number. So then we're going to click next. And it goes ahead and it populates from the information that the health plan gave us, the address. And if you need to change the address, you can absolutely do that. But I don't need to, because this is the name for Lauren. This is her address. So I'm going to simply click next. It's going to ask me, what is the day and time that I would like to schedule my visit? And there's actually two key things that I always like to point out here as well. Some people still don't like to have strangers come in their home. And maybe they would prefer to do this via a video. So off an iPad or using their iPhone. And that is absolutely fine and dandy as well. Some people like to have people, especially a clinician, come into their home. And then the other key point I always like to tell is really always find out what language. Super important that we speak in whatever language they would like. I'm going to go ahead and I'm going to press Spanish. And then I'm going to ask my member, what day and time? So a lot of people love weekend visits. So I'm going to pick Saturday, and then I can pick a time for that member to see that clinical team member. I'm going to say that my member doesn't like to get up early. And I don't know many seniors that do, so I'm going to pick 12 to 3. And then I simply click next. Now with this specific health plan that I've got here, they offer an incentive card for that member. I will tell you, not every health plan does that, but a lot of them do. So for example, WellCare, I have walked through with many agents, and we're seeing anywhere from $75 to $100 with WellCare, and it's typically been like a Walmart. So here's with this health plan, they are giving them a CVS, a Kroger, a Darden's, or a Subway food. I'm going to say that they want a Kroger card. And once again, I click that button for it to be shipped to them. And then I click next. I make sure that all the information is correct. I can put in here that the daughter or the son will be present. Or maybe there's nothing to put in there. And then this is our confirmation time. This allows Signify to do that outreach to say, hey, your clinician's going to be there. Super excited to see you between 12 and 3 on that Saturday. And I would put that information on there, and I would ask that member, how do they want to be contacted for that confirmation? And let's say that this is my landline. Then maybe I have my son coming. So I would put in here their information, and that way they could absolutely contact them with that confirmation. And then I simply click submit. I talk a lot, so it wasn't as quickly, but I have seen agents do this in less than 2 minutes. Super quick to do this, and all we're asking you as the agent is for you to schedule these visits. We want you to schedule these visits, and once again, we have agents that are able to book these appointments, and I know that many of you have large books of business. It won't take you but a few minutes, but it's $50 for every scheduled visit. So I'm going to pause there. And once again, this is just that confirmation information, and you can see that and see if we have any questions. I'm going to go and look in our wonderful.
Yep, I can read them. Yeah, I can read them for you, Jill.
Okay. Yes, ma'am.
The first one. Now, I know, do you work with all plans? I know it's not all plans. Do you have like a high level list of like maybe just the national plans you work with, or?
We work with every national plan. So, yep. So for example, we work with Cigna. We work with United. We work with Humana, Aetna. We work with WellCare. We work with, I'm trying to think what other big one, Evolent. We work with Anthem. We work with Health First. We work with there's over 100. So if there's a specific plan, absolutely let me know. I want to be able to answer if you have specific ones that I didn't, but all the big ones we absolutely do. And then a lot of the regional and then even state plans we are absolutely seeing. So for example, we are currently not with Jefferson Health, but we are actually reaching out to Jefferson to see if we can get them in network. So we've had some great success of getting more plans in network, and that's been at the behest of Pinnacle has asked us to do that.
Great. That's good. And then I know the answer, but so can this be done with our current clients? Yes, I guess maybe the process of how they would do it with their current clients.
So so let's walk through that. So let's say that you have, once again, you're a member and you've got a book of 100 members. When you can go immediately and just put their information, once again, at that schedule.signifyhealth.com, and you can pull that information right then and there. We also have a list of members that we did it only for Aetna, Humana, and also WellCare. We pulled kind of a master list of how many how many of those 3 health plans, how many visits. We want to kind of get the size and scope. And I can tell you that from Pinnacle, we have over 45,000 members with an eligible in-home evaluation. So there's a really good chance that your members are on that list. I'm working with the sales support team so that they can absolutely get that information out. Also, if you reach out to me, I'm sure that I can go ahead and pull that information down. It would be in a secure email that comes to you because it'll have a lot of HIPAA information. So when we think about your members today, you can absolutely do this today if you wanted to and look up members to see who is eligible. But also when you're meeting with your members during AEP, this really flows really nicely because it takes just a couple of minutes. Once again, it takes less than 30 seconds to see if they have an eligible in-home evaluation. So simply typing in first name, last name, date of birth, and that health plan information. And if they do have that available, literally it takes less than 2.5 minutes to talk with your member and schedule that in-home evaluation.
Cool. And then now I believe, do they get paid just for making the appointment regardless of if the member keeps it, or does the member have to keep it?
You betcha. No, ma'am. So that's something I really wanted to focus in on. Signify understands the value of a broker. We understand that your time is very limited. We know your skill set is super high. I have had the honor of working with so many of you, and the amount of time and energy you put into your clients is simply breathtaking. And I'm humbled to have been part of that. And so that was something that we really wanted to make sure is that this was based on you scheduling that member. We understand members may cancel their in-home evaluation, but that doesn't mean that stings the agent because they've spent the time and energy to do that.
Cool. And then when they're in the appointments, I didn't hear this, but I guess you mentioned that the nurse practitioners will make sure the member is in the best plan for them. Can you elaborate on that?
Actually, we'll make sure that they're able to access their benefits. We don't ever try to make, we are trying to make sure they can access their benefits for their plan. We aren't going to make any recommendations for plans because guess what? That's our brokers who own that. Only a broker is able to really sit down, talk to that member to make sure that they make sure they're aligned with the right plan. All we're doing from a clinical standpoint is making sure they can access those benefits. That's super important. Is if somebody is a diabetic, we're able to look to see, do they have the opportunity to go on a continuous glucose monitor? And if so, let's make sure that we connect them with that resource. Only the brokers can choose what plans they should be on.
Sounds good. And then for those of us that are working the retail booths, like the Walmarts, this open enrollment, do you have materials that they could maybe distribute to clients that would be appropriate, or?
I will see if I have member facing, and Serena, I don't know that. I'm sure that we do, but and I can go ahead and ask, but I'll see if we have member facing materials. Here is my only hesitation with that. Let's say that if we give a member a flyer and then they don't schedule with the broker's going to lose out on that $50.
True.
And so I'm sensitive. Yeah, I'm sensitive to that because I want to take care of our brokers.
Yeah. So really, George, you probably just want to schedule it yourself. You don't want to advertise it then, I would think. Yeah. No, that makes sense. And then, another question about getting a list of companies that work with Signify. So we said the national carriers, if you have like onesie, twosies, that's, you'll have Jill's contact info. I'm going to email everybody that's on this after, so you can follow up on that. I believe Blue Cross Blue Shield was yes, right, Jill?
Yes.
I know
yes.
Advance is.
Yes,
okay.
Ma'am.
Braven.
Yes.
Braven's
Anthem.
smaller. So,
Yep.
Okay. Yeah, Braven. Yep. Okay. They're under. Yep. So those are in. What are the key factors for an appointment eligibility?
So it's really the health plan. Yeah. So a lot of health plans, I will tell you, a lot of SNP members, so D-SNP members. We see a lot of SNP members on here. We have tried to see if there's a rhyme or reason of selection of a member. And I have to tell you, typically, we haven't been able to nail that down. I think the health plans like to keep us guessing, which they can absolutely do that. But they select those eligible members. The one thing I will tell you is that we have seen amazing things from our health plan partners. So we have seen where we have gone in and we've had members who have called us because, let's say, they've had a loved one that has gotten an in-home evaluation, and it could be a husband and wife, but the husband is not eligible for one. We've actually been able to contact the health plan and say, we'd like this member who's on the same exact health plan to be able to be eligible for an in-home evaluation. So anytime an agent puts in those member details, there's a back engine of Signify that captures that information. And we'll be able to go back to a health plan and say, can these members get an in-home evaluation? And when that health plan says yes, what we'll do is we'll reach back out to that agent and say, your member they are now eligible for that evaluation, so that they can once again book that appointment. Instead of us constantly calling members, we want the person who owns the trust of the member, which is the broker, to call.
Okay. And then this next question I think is a little more for me, but how do brokers get paid direct from Signify? So Signify is going to pay Pinnacle, then Pinnacle is going to pay the
Correct.
agent. It's not set up like a typical hierarchy. You don't have MGAs, GAs. It's a $50 per appointment. So there's no LOA capability. It's just paid to Pinnacle and then Pinnacle to the agent. So it's a little bit different in that regards. Okay. Can I get a PDF of the presentation? Yep. I'll be emailing that out after this call. Do you participate with AmeriHealth? I don't know if you know that one off the top of your head.
Yes, we do.
Okay.
Yes, that is correct.
Yep. Okay. What typically are the outcomes that result from an appointment?
That's a really great question. We've had, and that's why I have in the presentation where you can go and listen and also read some of those great outcomes as well. Yeah. Actually, I can actually pull that up right now because we're on here, and member impact. So lots of different things happen. So I'm going to scroll down and you can see these videos. We've got lots of them, but also we have comments. Typically, when we're in there seeing a member, we're able to answer questions. That's really one of the number one things that we're doing is we have a lot of members that have questions about any of their chronic conditions. So we spend a lot of time answering questions. We also go through, if they've had an exacerbation, connect those dots. We also have a lot of folks that have a loved one that comes and they'll also be there to ask additional questions, once again, of that clinical team member about mom, dad. So once again, that's always been a very good experience. We've caught a lot of things. I told you about the skin cancer story. We also had a member that, frankly, we came in and we took their blood pressure and it was low. And we started going and doing some other things and we came back and we took that blood pressure again. It was even lower. And the clinician stopped the visit and said, I'm not comfortable seeing you when your blood pressure is this low. And she actually told the wife that they needed to go to the emergency room immediately. That gentleman had open heart surgery and we saved his life. We've also gone in there where we've seen people from year over year where we've seen deterioration of members. They maybe have had a loved one that has died. Multiple things have gone on. And what we then did was advocate for additional resources for members because we knew that member. We were able to compare and contrast what last year looked like versus this year. We are in there to be an advocate for the member and to help them connect dots.
In this program, we kind of talked a little bit about the algorithm, about who's eligible. It's available year round, right? I mean, it sounds like it is.
Yes.
Yeah.
It is. Yep. And Serena, that's a really good point. So let's say today that we go on there and we look for Mrs. Jones and she may not be available in October. What's amazing to me is in November, she may be eligible. And so we get
Right.
these updated files almost weekly from health plans where they're saying, go see these members. And they keep adding members all year round. So when we started this year, we had, 10 million members they asked us to see. We've seen, close to 3 million members already this year. And we've actually been asked to see an additional 3 million members. So when I talk about being able to see 10 million members, it's because health plans continue to ask us to see their members and to have that clinical intervention. And also having that information in partnership with that primary care physician. We are not primary care. We are coming in there, we are seeing that member, and it's free of charge. This is no billing, no nothing. We don't ask for, there is no billing to their health plan. We don't take their card. We don't scan it. We do nothing. There's no copays. The health plan pays Signify for us to go and visit these members. And so primary care, we are absolutely sharing that information with them as well.
And that kind of follows up with this question I have here about, do we consult the member's doctor before we make any decisions? Sounds like yes.
Absolutely. So one of the things that we do not do is, let's say that we have a member and they ask us for a prescription. We will not do that. We will not write a prescription. That is us honoring the relationship of a primary care physician. And we feel that that's super important for us to honor that relationship.
Okay. And then now I had a couple questions, probably more for me, but does the carrier have to be contracted with Pinnacle? Yes. This is exclusive to Pinnacle. So Signify is going to pay Pinnacle. Pinnacle is going to pay you. So yes, carrier does need to be with Pinnacle. And it is a regular payment. It's not a type of reimbursement. So it's just that $50 flat. Does this work for people that maybe aren't on Medicare yet, like an ACA plan?
Yeah, you betcha. That's a great question. ACA, commercial, everything.
And is this just a one-time visit, or will they go will they start like doing monthly, or is that just determined in that initial visit, or?
It's typically a once a year visit. Health plans may ask us to go see a member a second or third time, dependent upon if they have chronic conditions. But once again, we don't substitute for primary care. We don't become longitudinal care. That is definitely the primary care physician. So typically, we see them once a year. And we have seen members, every year. And even members advocating for Signify to come in and see those members. So it's typically just once a year, but sometimes we get to see members a couple of times, which is always great.
Okay. And then now I've got I know we went over some of the regional carriers. We know Braven, we know Blue Cross, AmeriHealth. Clover keeps popping up because I know they're going to be popular this year. Do you work with Clover?
I'm going to double check on Clover. I don't know that one off the top of my head, but I'm going to find out, and I'll have that. I can absolutely answer that, and we can put it right in the email.
All right, that sounds good. And then George just followed up with his advertising material. He just wants it more to explain what it is. I don't know if they can make maybe a custom piece for brokers, just saying this is what it is. I don't know. So then he can schedule it from there for his Walmart, like when he's sitting at his booth. Yeah.
Yeah, so let me see what we have for member facing, and I'm going to ask my marketing team.
Okay. Yep. All right. And I know that we can identify brokers, current books, and let them know who's eligible. So the way you'll get that is by following up with Jill post this phone call. She'll send you a secure email of your member list of who's eligible now. Okay. Yep. Roughly, what's the turnaround time on payments? Like, is it a month after the appointment is completed, or every month? Okay.
No. So we don't wait for. It's scheduled. I was going to say no, not completed. Scheduled.
Okay.
So if, for example, when people are scheduled in October, that payment would be for. We will send that money right over to Pinnacle, and then that would be paid in November. So we look at this as an opportunity for agents for today, during AEP, and prep AEP, but during AEP. But also we look at this as a revenue opportunity for connecting with your members throughout the entire year. Because once again, we get those updated opportunities with new members all the time. We've asked the carriers to add next year in their membership list agent of record. So that way that if you have a member, we can also follow that up. Another question that I always get asked is, let's say that you're signing up a new member and you're not the agent of record today, but you're talking with them because they found you and you have a new customer. You absolutely can schedule them. Once again, all you need to do is put in that information of, your name, or if you're having, let's say that you have an assistant, that they are also doing outreach to your members. They would put in your name, your NPN number, and then they'll put in the first name, last name, date of birth, and then that healthcare ID for that member, and they can schedule that visit. So we understand that you get new members every single day, and that's fine and dandy. You can book anybody who has an eligible assessment in 24. You get to book it, and we'll pay you because it'll be attached to your name on our Signify site.
Got it. And then this is a good one. How does Signify make money? That's a valid question.
Yes, that is a very valid question. So what we do is we are paid by the payers. Those health plans ask us to go see those members. So we go and we complete a visit, and we are paid on the completed visit. So we aren't paid on a schedule, we're paid on the completion of that visit. So when you think about today, we have a whole team that is doing outreach calls, and they're dialing people's names, dialing people all day long. So in essence, what we're doing is we're taking the money that we spend on that asset to reach out and call that person. And instead, we're saying to the brokers, you reach out to your members. These are your members, and you go ahead and schedule them, and we'll pay you that money. So the health plan pays us.
Got it. And then when will this be available to us? It's available right now, so it's go live
today.
You can talk to you can talk to Jill right after this call. Get your book of business, get it calling, get those appointments booked. See here, is there a contract to sign up? I mean, I think just as long as you're through Pinnacle, you'll just work with Jill, right? There's nothing they have to formally sign.
That's exact. There is nothing they have to do because they are with Pinnacle.
Cool. All right.
Pinnacle has done all the hard work, as always.
Right. What if they cancel? Do you get charged back? I think we determined that one was a no, right? As long as the broker books the appointment. Correct. Yeah. And
correct.
I think obviously if we're starting to see a trend where every appointment you book, people are like saying, they're canceling, then that's something different. That might have to talk to you about. But, onesies, twosies here and there, people canceling, that happens. So that's understandable.
Absolutely. But Serena, that's a really great point. So if we had somebody who booked 100 appointments and 70 of them canceled, we'd be like, what's going on? We understand people cancel. Yeah.
Right. So we're being on the honor system here. Your calls do not have to be recorded because all you're doing is booking an in-home assessment. You're not talking benefits, you're not, and making an enrollment. So this is something that even your assistant can do for you, or your admin, whoever helps you out in the AEP. What happens if someone's health is so bad they should be in a nursing home? I'm assuming that the practitioner works with the primary care doctor on that, right?
That is correct.
Yeah.
And that does happen. And in those situations, it's typically that the member is so overwhelmed and they don't have a loved one to help them. And those situations happen. And what we're able to do is we are able to come together as a team, work with that primary care physician, work with the agent, work with if they have a family advocate or somebody, and it's kind of like a little community. All of us really step up because it takes a village to take care of our seniors. And that is something that Signify is very passionate about, is advocating for members and making sure that they have access to benefits. And anytime that they need help, we want to be able to help them.
Yeah. And now with the process, I know that the person has to qualify for this program. So if you're scrubbing a book of business now, you can tell somebody, here's your list of members that qualify. If they're like a new client and they're sitting with them, do they make the appointment and then you determine if they qualify, or how does that work? Or they put it in the system? I guess the new client part might be confusing.
So the best way, and because eligibility changes so frequently, because health plans open up eligibility for members all the time, is to really simply go on to schedule.signifyhealth.com. And once again, you simply can put in the first name, last name, date of birth, and the health plan ID number, and it'll tell you immediately if somebody's eligible for a visit. It literally takes less than, if you're a good typist, 30 seconds to put that information in, and it'll tell you right then and there if they're eligible. And once again, if you've got a new client and you are switching them from one plan to another plan, and they have an eligible in-home evaluation for 2024, you book it. They may have another one in 2025. And once again, you would be able to book that one as well.
Awesome. Yep. And we talked about it's $50 a person for each appointment you book. The clinicians are, the doctors, DOs, MDs, maybe physician's assistants, right? They go into the home.
Correct.
Yep, they take the blood pressure, they look around, they determine the environment's safe, some examples of what the clinicians do. Basically and checkup, really, right?
Yeah, and they're asking, it's a comprehensive opportunity for us to ask them, how are they feeling? They'll look to see if they have any chronic conditions. Let's say they have asthma. They're going to listen to their lungs. They're going to take their vitals. They're going to see if anybody's smoking in the house, which, let me tell you, that happens all the time with people with asthma, and that usually leads to a quicker progression to COPD. We're gonna go through their medications. We know that so many people double up on medications. We're gonna ask them when they take their medication. So let's say that you have somebody with a thyroid disorder and they're on levothyroxine, and we'll ask that person to tell me when you take this medication. And if they say, I take it with my breakfast, that's a problem, because with that medication, you need to take it 30 minutes before you eat. And that clinician will have that discussion with them because they know what all of these contraindications are for their medication. So it's really a lot about asking members, and also members getting to ask lots of questions. We want that. We want members to be involved in their care, and how can we help them have better days?
And are there different levels of eligibility? That's probably something on the back end, not something they would see, right? They're just booking if they qualify.
They're eligible. That's it. If they're eligible, they're eligible. And that's it.
Yeah. And my friend Vladimir was a little late, but yeah, you're automatically enrolled in the program since you're with Pinnacle. So you don't need to do anything to sign up. I am going to follow up with an email after this, with some materials, with the presentation, with Jill's contact info, so you could get your current book of business and see who now you could start calling and working on. And you will also get the video tomorrow. I believe that goes out a day later. So if you want to rewatch this in your viewing pleasure, you may. And after that, I think we did all the questions. That was good. That was a good group, guys. Yeah. A lot of interaction.
Vladimir, I'm excited to see. Yeah, perfect.
Yeah. Yeah, everybody seems really excited. So I'm going to stay on for a couple more minutes in case anybody else thinks of something. Oh, here we go. Do we as the brokers get any reports back about the client? Probably not. I would.
No,
assume,
because
right?
that would be HIPAA. That would be HIPAA violations. Yeah. So no.
Yeah.
Now, what we can do, I say that. We could tell you who completed and who canceled. We can absolutely do that because we'll be giving those points. We give those reports to Pinnacle. So
Okay.
we can do that, but we can't give you anything else.
And then do you have any kind of list about, I know you're talking about the incentive cards in the beginning. Do we have a list of what carriers do that with you? So they could start with those maybe as like a way to say, hey, do this and you'll get a Kroger gift card?
Yeah, what's interesting is it's all over the map. I know that I have seen people on WellCare. It seems like everybody in the universe on WellCare is getting anywhere from $50 to $100. So WellCare, everybody's got a gift card. I've seen Humana, just about everybody's got a gift card. I have seen United hit or miss, and I have seen Aetna hit or miss. Cigna has been really great as well. Really fantastic job there. Evolence and Anthem, really consistent as well, also giving those members those incentives as well. So many people say, well, members won't do it unless they get an incentive. And my response to that is, I hear them, I do, but they also are going to get a clinician to literally come in their home and be captive to any question they have. And if I wanted to have a nurse practitioner come to my home for an hour, I would have to pay $250 for them to come do an at-home visit, like if I paid for it myself. And so I look at that and I say, it stinks that we're trying to incentivize people because these are highly skilled clinical people. Their sole focus is to help members. And for a gift card, for a member to say no, I'm like, oh, do you realize what you're giving up? You're giving up a highly skilled member who can answer so many questions and can help you so much.
Yeah. Yeah. And that actually kind of follows up with this next question with women visits. Will they do, PAPs in the home? Is that something? If you have somebody that maybe can't get to the OB?
No.
Okay.
Yeah, they won't do those invasive procedures. We can get blood draws. We can do that, especially, we look at A1Cs and things like that. And then once again, one of the great things that we are really able to do is we've got this really robust network, once again, because of the health plans, where they have said, if a member needs X, so that's a great example. If a member has gynecological services needed, we can see if with Humana or with Anthem or with whomever, if they've got those services, and then we'll connect those dots. That's the one thing that, I am so excited about is looking at all the different health plans and looking at all the wraparound services that we can help members connect to. And we're able to deeply help members. And that's highly rewarding because at the end of the day, every one of us want to make sure members are taken care of. And I get to watch that now happen. So it's pretty humbling.
And then the gift cards, those are coming from the carrier. That's not from Signify. So that one I can answer.
They come, they come directly from the carriers. And there will be members that say, hey, I didn't get it. And what Signify, they can call Signify because we always leave our information. They can call Signify and we once again will be advocating to make sure that member gets that gift card. That happens. We know that happens, but we will help them.
And do we have, and I know that, rolling this out to brokers is kind of new. So do we have any sort of like phone script idea?
I do.
Draft?
I have.
Oh, cool.
I sure do. So, I created a broker resource guide, and in that has key points, and it has a script because I always love a script. And so those are approved scripts. I put a couple of those scripts right in there, so that our brokers can take a look at those. So I have them under the broker talking point. Already done because I think that it really helps all of us.
And that attachment I send out, I must not have read that very well. So there you go. So
you're a little busy, Serena. Just a little.
So we do have that. If you guys don't have anything else, I would say that's a wrap, and you'll see my email within the next half hour, so you can certainly follow up with Jill too. I'm sure she'll be happy if you have more questions or want to look at the enrollment process again. Everybody will get that broker guide, absolutely. So I will send that out. And then obviously you'll get this video again tomorrow. And if there's anything else you want to pop it in the question box, if not, we're almost at the top of the hour, so you'll be free to go. And thank you, everybody, for coming out. I know it's a busy time of year, so I really appreciate it. And, yep, you'll get Jill's contact info. Don't worry, I'll make sure. Yep. And I'll just stay on until 2 more minutes. And then I think I'm going to get cut off at 3, actually. So we're right at the top of the hour. I think we just get cut off. You're welcome. Thank you. Thanks for coming. What's the average turnaround time to make appointments? So I guess
typically you can go right in to make that appointment, and we have people that can be seen the next day. We have people that if they're in a highly dense area, it could be that they've got to wait a couple of days. So they have that calendar. They can pick the day and time that those members want that visit.
Okay. Sounds good.
Super easy to do.
Okay. Is there a number to call if we have questions? Is it just you, Jill, or do you have like a support team?
I don't. You know how I am, Serena. Whenever we're kicking off something, I want to be the one. Yeah, I don't trust anybody else with Pinnacle.
Not yet. Nope. So it's just going to be Jill. Nope. So you're going to reach out to Jill for now. This might get too big at some point, but for now.
That's fine. But once again, I want to make sure everybody's taken care of. It means a lot. We got to get it right.
All right. Well,
thanks all.
We're going to let everybody go. I'm going to email you guys soon, and you guys have a good rest of your day.